didn't realize when you freeze your eggs, they freeze them in batches. Most fertility clinics freeze them in pairs.
Yes.
I only froze 7. They froze a 3 and a 4. So instead of having 7 chances, which is what I thought I have 2. So I thought the batch of 3, they fertilized, but they weren't viable beyond day 5. And so I thought, I was devastated. So those are the conversations now that I want to have with our younger sisters in their 30s. Like, let me be clear. It's not 7 chances. Freeze like 30 eggs if you can.
From IVF cycles.
Yes, because you don't know what will happen. And freezing at 38 was late too. I didn't know that.
A common misconception that I hear all the time, especially when people come back to actually use their frozen eggs, is that they assume that we may thaw one egg out at a time to help them get pregnant, meaning come back, thaw just one egg, fertilize it, try to grow it into an embryo, and then transfer it and see if it sticks. And if it doesn't, then go to the next egg. However, that is not the case. Whether you're talking fresh or previously frozen eggs are inefficient, human reproduction is inefficient, and to illustrate this, we fertility doctors will often say things like, think about it as a 10-to-1 ratio when it comes to how many eggs are typically expected to be needed to have a single live birth. And this is kind of something you see across the board, even in younger patients. Now, obviously, this is going to depend on age, which predicts the likelihood of any given frozen egg that you have being healthy and having the right amount of DNA or chromosomes to implant and turn into a baby. As you can see from this graph from my egg freezing guide on my website, theluckyegg.com, you lose eggs along the way at every step. When it comes to surviving the thaw, many eggs will, but not all of them, fertilizing, and then there's a big drop off going from a fertilized egg turning into an embryo. And then there's the question of, are the embryos that are yielded even genetically normal with PGT testing? And even if they are, that's going to give you about a 2/3 chance of live birth per embryo. So it would be extremely inefficient to just come back and thaw out one egg at a time. It would increase the number of rounds of thawing that you would need to do. Ideally, we should start out by thawing a larger cohort of eggs. It doesn't need to be all of your eggs, but then we see what they can do in the lab after the thaw. It's a matter of survival of the fittest. And this is why in our lab, we tend to freeze eggs in pairs on a little strip called a cryotop device. And this gives us a lot of flexibility. We can divide up the eggs and thaw a limited batch or thaw all of them, but it's never going to be just one at a time. Now, a lot of people worry about this approach and will ask me, well, what about the extra embryos then? Do they just get wasted? And the answer is no. We freeze the extra embryos, and there's no issue with having frozen eggs that are turned into frozen embryos that can then be thawed out in a calm, controlled fashion, one at a time, to help you get pregnant or try to get pregnant. Now, as for this woman's story about thawing 7 eggs in total that were frozen when she was 38 and not having success over 2 batches being thawed 4 and then 3 at a time, it is true that the older we get, the more eggs you typically need to be successful with eggs in general, whether they're frozen or not. This 2022 study on live births from frozen eggs at a large center reported a live birth rate of only 39% from a large cohort of patients of varying ages that came back to use their eggs to try to get pregnant. But when you looked at the patients who froze at least 20 eggs before they turned 38, the live birth rate rose dramatically to 70%. So age and the number of eggs you freeze are the most important predictors of success when it comes to freezing your eggs. You can't change your age, obviously, but you can choose to do more than one round if you get a limited number of eggs from only one round of egg freezing. You should check out my calculator on theluckyegg.com, my website. It calculates your chance of success based on your age at time of egg freezing and the number of eggs you froze. The last thing I want to say is that the major downside of egg freezing and trying to conceive in general is that there's a major unknown. You're not going to know until you try. And only when you come back to turn your eggs into embryos will you know what you truly have and what your actual drop-off was from egg thaw to turning them into embryos and then trying to get pregnant. So if someone comes to me over the age of 38 and they want to preserve their fertility, let's say they're in their 40s, I will counsel them about this and the fact that it typically will take more eggs to be successful, and it's harder to know how confident you can feel with your frozen eggs because of the inherent egg quality issues that crop up with time. So sometimes hearing this, some of my patients in this situation will decide that they want to use sperm to create embryos so they know where they stand, whether it's from a partner or a sperm donor. And you can PGT test embryos. You can't test eggs. With embryos, you've already gotten past all of the attrition. And so this can be really informative. If you don't get as many as you had hoped, then that may prompt you to do another cycle then and there. I've had some patients who've decided to do a round of egg freezing to maintain flexibility so they can use these eggs with a future partner, but then also on the side freeze some embryos using donor sperm so that they're covering all of their bases as best as they can. Fertility preservation is a wonderful technology, but one really needs to understand what the stats are based on their age and their particular situation so that they can make an informed decision.